I want to let you listeners know about a new opportunity through GenoBank. GenoBank allows you to participate in the genomics revolution with maximized privacy. Blockchain networks are utilized to keep track of all the data sets and genomic reports without exposing your personal data and, in turn, your family's data. GenoBank creates a way for you to decide who has access to your genetic information. The aspect I'm most intrigued by is how you can take part in research to further science by choosing specific institutions and even projects to contribute your DNA. Check it out, genobank.io.
How is it that we find ourselves surrounded by such complexity, such elegance?
The genes of you and me, the genes of you and me, we're all made of DNA. We're all made of the same chemical DNA. We're all made of DNA.
Hello, you're listening to DNA Today, a genetics podcast and radio show. I'm your host, Kira Deneen. On this show, I explore genetics' impact on our health through conversations with leaders in genetics, such as genetic counselors, researchers, doctors, and patient advocates. This episode, we're exploring medical interpretation in genetic counseling and other areas of healthcare. Joining me are genetic counselor Nina Harkavy and interpreter Lorraine Way. Nina is a prenatal genetic counselor at Columbia University. She graduated from the John Hopkins University NHGRI genetic counseling training program. Lorraine is a Spanish instructor. She actually taught me at Sarah Lawrence. She's also a medical interpreter and the president of Language Way, a language service company. She has a master's in French from Middlebury College, where she also studied Spanish. Thank you, Lorraine and Nina, for coming on the show. I'm really excited to dive into talking about interpretation and being able to use interpreters. I think we have a really good show ahead of us. So thank you so much for coming on.
Thanks for having us.
Yeah, thanks for having us, Kira.
So Nina, how has your counseling experience changed? You previously didn't speak any Spanish, and now you have like a working proficiency. How has that experience changed of going from knowing very, very little Spanish to now being able to communicate with Spanish?
Yeah, I mean, it's a world of difference. I cannot even tell you, it's changed things in so many ways. Again, the position that I was in when I didn't have any Spanish, you feel kind of disconnected from your patient. You're worried that the patient isn't getting the level of care that they might get if you understood them more clearly. You worry that there's a mistake in the interpretation that you won't be aware of. So, being now able to understand what the patient is saying, what the interpreter is saying, and to some extent to make myself understood as well. I mean, it's changed everything. It's changed the level of care that I think I provide because I'm able to understand more directly kind of what the patient is looking for without getting things lost in translation. I'm able to just make sure the session is as accurate as possible and correct mistakes as they come up and ask interpreters to clarify. And then it's interesting, I have some more like cultural insights now. There are things that I never would have picked up on without understanding the language that are very subtle, that now that I understand my patients, I kind of get a little bit of a view into, what is more relevant for this patient that I might not have considered. So
everything's more
it's
transparent there.
Yeah, absolutely.
And Nina, I'm just curious, when you say some insights culturally, can you think of anything specific that jumps out at you?
Yeah, so I think, it helps me connect with the patient. One tiny example is that I had a patient recently. I was asking her why she had a C-section, and her response was, supuestamente. So she was very much emphasizing supposedly. And, then she said I was past my date. So the interpreter just said I was past my dates. And I had a student in the room, right? And so the patient and I laugh because she's from a country where they do a lot of C-sections that may not be medically necessary. So she and I now have this understanding of like, I just had a C-section because, and the student was like, hey, I feel like I missed something because you and the patient had this moment where you guys laughed about something, but the interpreter just said she was past her dates. Like, what was funny about that? So it's little stuff
great.
Like that.
What a great example.
And
Yeah.
I'm sure that really helps you build rapport with patients instead of,
Yeah.
sometimes I've seen when genetic counselors and other healthcare providers, this kind of all applies to anyone in the healthcare field, that everybody's looking at the phone and not each other. Whereas I'm sure now you're looking at each other and the interpreter's kind of chiming in and helping, making sure you're understanding at that 100%. but you're picking up on so many more subtleties and really having that like human to human connection, whereas sometimes that's lacking when you're totally reliant on an interpreter.
For sure. I mean, my patients might start by like kind of talking to the phone because the interpreter is by phone. But then as soon as they realize that I understand them, which they realize very quickly, even if I don't explicitly state it, they realize that I'm understanding them. First of all, they're so happy that I can understand them. And then they look directly at me. They stop saying sentences like, tell her, meaning me. They just talk directly to me. I think they're more likely to disclose information to me because they know I'm going to understand what they're saying. And it just, again, tiny little things that you wouldn't think about. Like my patients, again, culturally, some of them are more likely to use terms of endearment or like pet names. And so I hear frequently patients say mi amor. And I think that that's nice in the sense that maybe that means they know I'm being sincere. So even if they're about to decline everything I'm offering them and they're like, no, but thank you, mi amor, I really appreciate you taking the time. The interpreter has never, ever translated that. I've never heard an interpreter translate that phrase. So it's like, I'm so glad that I know that they're saying that. And I think that that means they feel a little bit more connected to me than they otherwise would.
You're not missing those subtleties that are really important. That, maybe when you're being able to interpret that direct language, it's like, okay, yep, we covered this. But it's like counseling is not just the information given. Otherwise, we would hand people a packet.
Do you have a comment on what Nina just said, which I find very interesting, that the interpreters are not interpreting those terms of endearment? Because as a trained interpreter, we have pretty much a code of ethics to interpret everything that the provider is saying, including hums, and pauses and nonverbal forms of communication and tone. That's what our job is, to interpret all of that too. So I'm a little surprised that they're always omitting that. It's curious to me. But I'm thrilled that because of your knowledge of Spanish, you're able to pick up on those subtleties and build the rapport with the patient.
What are some general tips you have for working interpreters, for the genetic counselors listening, the healthcare providers?
Well, some may be obvious to people who are currently working with interpreters on a regular basis. But we actually are, in our pre-session, we are also trained to ask you to speak, to pause frequently. That's a big one. It's easy to get caught up in what you're trying to convey to a person, and especially in an emotional situation, and start speaking more rapidly and with longer sentences that are always harder to interpret with a high level of accuracy. So I would say the pausing frequently is one. Speaking in somewhat shorter sentences, somewhat, not always. And then if you can at all, in avoiding idiomatic jargon, slang, and idiomatic expressions are harder to be highly accurate in an interpretive environment. It's not that it can't be done, it's just that it gets harder because any form of familiar language is deeply rooted in the specific country and sometimes the specific town. So there's just too many variables there. So if you speak more in standard language, plain terms, commonly used vocabulary, those are some good things that are helpful in interpretation.
So staying away from, I was so engaged, my eyes were glued to the TV, because that's not going to translate very well using something like that. Right. That's what you mean? Yeah.
Yes and no. That's a pretty good example. And just to know that interpreters are required to interpret meaning and not words, right? So glued to the TV, we might say attached to the TV, and that the interpretation in Spanish might sound like attached to the TV and not use the word glued, because that's not probably what they would be using. So that is actually very important in terms of interpretation. It's not words, it's meaning.
And I think that's where you get at what the difference is between translation and interpretation, because we've been talking about interpretation, but can you differentiate the two for our audience?
Yes. Translation is the written word only. Interpretation is oral only. So they're not interchangeable. Translation is going to have a more exact quality because you have time to research. If you're actually translating a written page or a book or an article or anything that somebody's doing or medical notes, if there's something that you don't know, you look it up, you have multiple dictionaries, and you get very, very exact. Interpretation, when I say meaning and not words, we'll go back to one of the examples of you used a somewhat slang expression, right? If somebody says, oh, I'm just pulling your leg, that's like an idiomatic slang expression. But the interpreter might interpret that as I'm just teasing. And there's no loss in the interpretation because you have accurately conveyed meaning. Whereas in a written document, a translation, that's not acceptable. You need to go back and find that as close to an equivalent. Sometimes there's no equivalent, but often there is. So you have to find that and correctly translate that in writing.
And along those lines, what are a few concepts that are challenging to interpret in Spanish? Nina, is there a concept that you come across a lot that you're like, this, I always have to phrase very specifically, or I have to say it very different than I would in English?
Yeah, there's two in particular. So one that comes up in every session, actually both come up in every session, but one would be carrier, the term carrier. And I think that especially in interpreting for genetics, and I thought this was maybe my bias because I'm in genetics, but I talked to a couple of other healthcare providers, and they said one of the hardest things with using an interpreter in genetics is that many words don't have a synonym. You just have to define the word. And so the word carrier, for example, has its own connotation. We know what we're saying. You know, if I say the phrase, if you and your partner are carriers of the same thing, you may have a child who has the disease. That does not get translated correctly because there is inherent context that we're not explaining, right? The word carrier has its own context. So what happens is the translation ends up being, if you have a disease and your partner has a disease, your child may have a disease. And that's obviously not what I'm saying. So I've learned to be super careful about, saying if you are a carrier of a genetic condition, meaning that you don't have any symptoms and you are healthy, and your partner is a carrier of the same condition, is also healthy, there is a chance that both a healthy mother and a healthy father may have a child who does have symptoms and is not healthy. And it sounds kind of repetitive. I'm using a lot of the same words over and over, but I'm trying to get meaning across rather than relying on the word carrier to include meaning, because otherwise, again, it gets lost. So that's one that is constant. I really have to define carrier in order to use it. The other one that comes up a lot is it's really tricky to do a pregnancy history. And Lorraine and I definitely talked about this a lot because the word aborto is non-specific. It doesn't tell me whether that was a miscarriage or a termination. So when a patient answers a question with, oh, that pregnancy resulted in aborto, I don't know what that means without further clarification. And that being said, often what I've noticed is if I ask if a patient has had any terminations, they're automatically like, yep, 4 terminations, 40 weeks. And you're like, okay. And by that, you mean completed the pregnancy. So it's like that often also gets lost in translation where they're saying, yeah, I had 4 complete 40-week pregnancies, term pregnancies, not termination, which we know to mean abortion.
Right. So they're confusing the word terminar with a término. Right? So terminar is to end. But a término is what you're looking for something going to term, right? And you're right, to avoid confusion in case your interpreter is not picking up on the nuance there or the clear meaning there, then you would definitely need to add that follow-up question. Absolutely.
Wait, you're still drawing pedigrees by hand in 2020? Don't worry, we have a solution for you. Phenotyp's complete genomic health record not only has intuitive pedigree drawing tool, allowing you to capture complete family history 2.5 times faster than pen and paper, it has a pre-visit patient questionnaire that auto-draws your patient's pedigree, customizable into multiple languages. On top of pedigrees that draw themselves, you can capture all relevant patient information and get diagnostic insights in 6 different languages. This ensures clear communication with your patient, no matter what language they're comfortable with. As we're learning in this episode, clear, accessible communication is the heart of empathizing, understanding, and supporting your patients. See it for yourself. You can book a short demo at phenotyps.com. Again, find them at phenotips.com. I'm also the host of the Phenotips Speaker Series, where I have interviewed genetic counselors about topics like telehealth, digital tools, leadership, and precision medicine. You can watch all these free webinars on demand at phenotips.com. Just click the Stories tab, and you can stay tuned for future installments in 2021. And Nina, do you have a way of checking with patients that they're understanding the information? I mean, there's ways that, sometimes in English you can really sense if someone is understanding, and sometimes you can, and that's a whole nother area. But with Spanish, there is more of a barrier there. You're taking down the barrier quite a bit of understanding and being able to communicate in Spanish. But is there certain ways that you're able to check in with them without feeling like maybe you're quizzing them? Is there an approach there that you've learned to kind of finesse?
Yeah, that idea of quizzing them is so damaging. You don't want them to feel like you're giving them a pop quiz, especially if they're from a culture that really does not want to be seen as incorrect or stupid, unintelligent. So I think, some of it is context, right? So if you ask a question and you get an answer that doesn't quite make sense, like, have you had a termination? Yep, at 40 weeks, you're like, nope, wait, something went awry there. And then also, occasionally the questions that they ask me, like, okay, so if this is positive, I need my partner to come in for testing. Like, great. That shows me you at least got something about the carrier screening aspect, that it's for both parents. And my favorite is actually if they have someone with them or somebody on the phone that they're interpreting to in Spanish, like, if their partner is like, wait, I'm confused, and then the patient explains to the partner what they're doing, I love that, because then if I hear the patient explain it correctly, usually in like a very kind of basic level, because they're just talking to their partner, it's amazing, because I'm like, oh, you absolutely got it. I can hear you explaining it.
Yeah, it's a good feeling when you can say, okay, I really, genetic counseling sessions aren't super, super long. Usually you have a lot of patients that, are moving in and out. And so to be able to teach them that information and then seeing that they actually have it is like, you have that teacher moment of like, wow, okay, my patient got it. I'm proud. I'm glad that could come across well. And I'm sure using translators too, that sometimes there's miscommunication with them, not even the patient, but just between you and the translator. What have you found to be some sources of that miscommunication? And then we can hear from Lorraine's side. Yeah.
So again, I think a lot of it has to do with like, where you're going with these questions, and some of your words have context inherent in them. The interpreter does not know where you're going with things. So sometimes it's just an issue of they're not even translating incorrectly or poorly. It just didn't get across, like in the carrier example. But I've had these kind of disturbing examples that have come up where if I didn't understand Spanish, like, I'd be really concerned for how that session would have played out, because, in one session, for example, I had a patient, we had diagnosed a fetal heart defect. And so I knew the patient was in a little bit of denial. And I started the session by saying, we know that there is a problem with the baby's heart, but right now we don't know why. And that was translated as, we don't know if there's a problem with the baby's heart.
Oh.
And that Right.
Big
That kind of
difference.
killed me. And I don't know exactly what happened there. I don't know why that was the translation per se, if I wasn't clear, but I, immediately had to jump on that and be like, actually, interpreter, that's incorrect. I'm sorry, but it's really important that you clarify. There is definitely a problem with the heart. The only part I don't know is why. So sometimes I don't know why there's a miscommunication. But I appreciate when the interpreter tries to resolve it. I appreciate when the interpreter pauses to ask for clarification. And I struggle with when an interpreter maybe doesn't understand what I'm saying, but doesn't ask. So sometimes what happens is I'll say a word that they aren't familiar with, like amniocentesis. The majority of them will ask me, for more information about that word. But some people just kind of make up a word. Like, I'll say amniocentesis and they'll be like, and I'm like, what just happened? Like, why? Yeah. So I've learned to, if there's a word that I want them to use carefully, I will spell it for them, or I will provide them the word that I want. Carrier should be translated as portador or portadora. If it's anything else, it's typically like incorrect. And so I've gotten really careful about spelling words for people so that they're giving the correct word, or about providing them with the word that I want them to use.
And Lorraine, did you want to jump in on your side of where miscommunications can go wrong?
Well, I do want to comment on a couple of the example examples Nina brought up, and also to her point of sometimes the interpreter doesn't know where the provider is going. So as you know, medicine is a huge field. So when you are receiving somebody as a medical interpreter, they're definitely not going to have the expertise in every area that you might need them to or want them to. So it's common for certain medical terms that an interpreter may not have come across. Amniocentesis is not one of those words that I feel. Although in quite a number of countries, they don't even have access to an amniocentesis or may have even have heard of it, which for our world is sounds very unusual. But in my interpreter course, there were many countries that didn't have the test at all, and there was no word in their language for that test. So you can have that arises. But to the specific alarming example that Nina did give, I do not see any reason for that to not have been interpreted exactly accurately. And fortunately, she does speak quite enough Spanish to know the difference and intercede and ask for a correction, for sure. I myself have an enormous exposure to medical experience, having grown up with a mother who's a nurse and a number of doctors in my family, and have been teaching medical Spanish for over 20 years. And I still don't, of course, know everything, but far from, right? I'm learning all the time, as we all are. But so from my own personal experience, I'm going to have a little bit of a better understanding of where the provider might be going with something. But absolutely don't hesitate to stop and ask, or even if you find that particular interpreter is struggling way too much, or you find way too many inaccuracies, to switch interpreters if it's on the phone or if it's face-to-face, to ask for a different interpreter. You have every right to.
And you really have an obligation to the patient to say, you know what, I can tell that this is not going right, and say, I'm sorry, interpreter, I'm going to have to get someone else. And that really is your responsibility as a healthcare provider.
Absolutely. And a couple of those points, the interpreter was breaking code of ethics. They are never, so no one is ever supposed to make up a word if they don't know. Right? I mean, that sounds obvious, but we do receive this training as part of our program, in a professional medical certificate or certification. You are trained in those ethics that if you do not know, you ask the provider. If it's a word you don't know, you ask the provider to explain what that word is. If I were to end up in certain points of oncology, I may not know some words. I do a fair amount in mental health, genetics and other specialties, but they might elude me with some specialized term in oncology. So I might have to ask the oncologist, could you please explain what that is?
And Lorraine, what is involved? You said a little bit of the training process, but what is required to actually become a medical interpreter? Because I think a lot of people, I didn't know before, being your student, of what is required of medical interpreters to be able to be in this role.
So there is a very wide range that you're going to see and experience. And you probably would know just by working with some of the interpreters, those that have the higher levels of trainings versus those who don't. So at the top level, there is a national organization that certifies medical interpreters. This is going to become the golden standard, but it is not yet the golden standard. The people that have that background are going to have a bachelor's, a master's degree. They may also have a degree in interpretation from one of the schools in this country or abroad. And then they would have to pass extensive examinations in this national certification for medical interpreters. That's a very high standard. Most of the interpreters that you're having work that you use are not going to have that standard. Those that I have seen, based on my small experience in this field, the reason is my primary field in languages has been teaching translation and now interpretation. So I have experience interpreting, but not as much as translation and the teaching of medical Spanish. So the access that I have to that right now is that those that have the higher levels might be one or two face-to-face hospital interpreters that are hired, and they're also supervising the team of interpreters. If you start going down the scale, sadly enough, when I started to look for work to supplement my income in medical interpretation, almost all of the ads said high school diploma.
Mm-hmm.
And those people may or may not, they mostly, if they're hired by an agency or by a telephone interpretive service, they have passed some kind of test to get hired. And that's usually an audio, a pre-recorded audio test that they have to interpret, and then that's graded, that's recorded and graded. It's that type of test, not, I don't know if some of them have written tests. I haven't seen that yet. So, at the very low level, which could be quite a number of the interpreters that you have, you could have someone with a high school diploma that has maybe a certificate, a brief 5-week certificate in medical interpretation. At the top level, master's plus extensive certification experiences. So the range is huge, and I think that's part of what's going on in the profession, that it's starting to, they're starting to work toward more higher level professionalism and more standardization. It's just a field that interpretation by and large in this country has not been enormously standardized.
Yeah, I think that's a really good point, in just that healthcare providers may not know really the extent of like how much the interpreter has in their background of education. And I think beforehand, I thought that, they must have a master's. That's kind of what I was thinking. And that's not the case always. So I think that's something to be aware of. And
not at all. Right.
And another point of just kind of throughout this episode that we've had is any amount of another language that you can learn is advantageous. And I hear this a lot in the field of from students saying, our medical Spanish class at Sarah Lawrence College, only some students took it. It's an elective. And so, some people were saying, what's the point in just learning a little bit? I'm going to use an interpreter anyway. And I think me taking this class, I've really seen the other side of it, is like, the more I know, the more I'm able to see if the translator is accurately doing this and connect with my patient, even just a little bit, if I'm asking them how they are, what their name is. And so I think that's a really good point that I just wanted to pull out, because I think you guys have really highlighted that a lot. And Nina, I'm sure you can agree with me on that it's
Absolutely.
Really helped you.
Yeah. And I think that that's so valuable, because again, as somebody who was just learning Spanish from the beginning, in my 20s, and this is going to apply to a lot of training genetic counselors who are 20s, 30s, whatever, learning Spanish for the first time. I don't want people to get discouraged by like, well, I'm not fluent. I'm not going to be fluent for a long time. Like, I don't care. It's so helpful. It is so dramatically changed, how I interact with patients and the level of care I provide, that I would love for this to be standard. Genetic counselors should have training in Spanish. So I just think no matter what, like, any level of comprehension that you can get is better than none.
Yeah, and I hope that too. I'm sure in the future, I don't know how soon, but we'll see this start to be part of, the accreditation board saying, okay, programs need to have this offered. Maybe students aren't required to take it, but have it be offered, because as far as I'm aware of programs that I've talked to and other students, there's not a lot of schools that offer this. It's something that students seek outside of their curriculum. And so, I think the three of us are in agreement on that it's really important. And I think that's kind of to myth bust a little bit of learn a little bit if you can, and kind of keep going from there.
Mm-hmm.
Right. I do have something to say on that. It's absolutely amazing to me to see how far people actually progress in a short period of time. So one of my current students has studied Spanish for a year. She has been working, really working in the language after 9 months. At the 9-month mark, she started to really work. And now I think her sessions mostly go with, she has the interpreter present on the line if she needs it, but she tells them, I'm leading the session and I'll ask you if I need anything from you. And so, this is the type of thing that can happen. The other thing that I want to point out, especially since people are still in graduate school taking these classes, you're at the point in your life where You might start with a little. You might start with 3 months or 6 months, which is a small amount of Spanish that can get you quite far in some regards, but maybe not able to do your entire session in Spanish, right? But at that point in your career, oh my gosh, even if you end up studying Spanish for 2 or 3 years effectively, you will be working in Spanish in your career, in your lifetime, because you're early on in your career, which is a beautiful thing. And I do hope that most programs start going toward the concept of including it as part of their curriculum, because we're really at that point now, and it's really exciting to see that happening.
Very, very well said. And I think we've left the listeners a lot to think about and hopefully start brushing up on their Spanish or diving into other languages. So thank you both for coming on. Really appreciate being able to dive into this different kind of episode and different topic for healthcare providers.
Thank you so much.
Thank you.
You can check out Lorraine's website, thelanguageway.com, and DNApodcast.com has all the information you're going to need about DNA Today. I have so many other interviews with genetic counselors. They're probably my most popular guests that come on the show. So you can check out interviews with genetic counselors and many more types of guests, all on DNApodcast.com. The podcast players don't have all of the episodes because there's over 100. So in order to listen to all the episodes, you have to go to the website, dnapodcast.com. If you're on Twitter, I'd love to connect with you at DNA Podcast. Instagram, I'm at DNA Radio. Any questions for myself, Nina, or Lorraine can be sent into info@dnapodcast.com. There's also a contact form on the website if that's easier for you. We are happy to answer any questions that you've thought of throughout the episode, or if you have comments on what we discussed, if you have some insight to share that wasn't expressed during the episode, or you want to echo something we did say, email in at info@dnapodcast.com. If you haven't already, please drop a rating and review on the podcast app you listen to, especially if it's Apple. It's really quick and helps the show. Imagine a health record system that's actually designed for genomics, available in 6 different languages, and complete with pedigree drawing, diagnostic insights, and more. Well, stop imagining and start using, because Phenotyps is nothing like your EHR. It's the world's first genomic health record system that captures family history seamlessly, regardless of the language patients are comfortable with, because clear communication is the root of supportive care. Visit phenotyps.com to learn more. Be sure to check out GenoBank. As I mentioned before, they are the first anonymous DNA storage and sharing platform that is completely controlled by you with blockchain technology. Other companies share their data and it's not locked down. Here's the really cool aspect about GenoBank. You can choose who you are sharing your DNA with, including researchers. That's right, you can be a partner in research by choosing specific institutions who can use your DNA in their research projects. GenoBank is like a matchmaker between researchers and people like you who want to contribute their DNA towards scientific advancements. You can even get paid for your valuable DNA. You also have the control to decide how long researchers have access to your genetic information. GenoBank has officially launched, so head over to genobank.io to explore more and buy a kit. Again, that's genobank.io to join the genomic revolution. Thanks for listening, and join me next time to learn and discover the new advances in the world of genetics.
The genes of you and me, the genes of you and me, they're all made of DNA. We're all made of the same chemical DNA.